Jim Hrncir, if I said that right, please.
Hrncir.
Thank you.
Crazy Czech name, sorry.
Okay.
I'm a little upset because I was told I only had 5 minutes, and now I've got 15, and I'm really wordy. But thank you for having me here. I'm Jim Hrncir. I'm a traditional medicine pharmacist and also a compounding pharmacist, and it's a great pleasure to get to be here in front of you. In my practice, my time is devoted to providing clinical and treatment plan support for my patients. I work very strictly within a framework referred to as the patient-pharmacist-provider triad. And to be clear, when you hear me use the term that I treat, I'm really talking about my role within that triad. Given that pharmacists are often touted as the most accessible healthcare providers, we're uniquely situated to listen, to counsel, and to help patients strive for better health, because that's what we're all about, right? In my practice, some of my prescribers are wonderfully adept at providing this PHRT, or personalized hormone replacement therapy. Others, not so much. And so they ask for my help in managing the case, assessing the case, and also giving suggestions for treatment plans. In addition, it is the critical job of us compounding pharmacists to assure the quality of compounded medications dispensed to our patients. We rigorously adhere to carefully considered quality assurance and quality control programs that are specific to our location. We also comply with both state and federal regulations regarding compound. I'm happy to provide a brief overview of our QA and QC later if you'd like, okay? I wanted to take a moment here to just humanize this a little bit. I'm sure each of you have a story as to why you became who you are, and I'm no different. After graduating pharmacy school in 1979, I worked for the chain stores for 3 years, and then I had an opportunity to open my own store. As a caretaker personality type, that just suited me just great, and I was thinking, oh my gosh, I'm going to have personalized care in this store, and this was before I'd even thought about being a compounder. And the chain stores in those days, the thinking is that you need to stay behind the glass, keep your head down, and fill prescriptions, and do not have patient contact. And that was just not the way I was raised. So I had those normal starry-eyed business ownership ideas, and my wife, Jan, who is not a pharmacist, worked with me in the store, but also kept working a second job just because those were rugged early years, I can tell you. But I have Jan's permission to share a little of her story. And honestly, it could be any of my patients' stories because I see this repeated weekly in my patients. So Jan had this crazy dynamic personality. She had a photographic memory, and she was an extreme multitasker. As they say in Texas, she had 5 irons in the fire and knew what they were all doing. A year later, after we opened the pharmacy, Jan developed uterine fibroid tumors the size of softballs. And I'm sure that you gynecologists have seen this, and it's a tragedy. So after the surgery, I was left with a 28-year-old menopausal girlfriend. And I thought, oh my gosh, what am I going to do? I didn't even know what a fibroid tumor was before then. And I certainly didn't know that deficient progesterone levels might contribute to an increased risk of fibroid tumors. So after the surgery, a cascade of symptoms and health issues began. Of course, she had hot flashes and night sweats. It was surgically induced menopause. But what is seldom discussed among my traditional medical circles is the health sequelae resulting from hormone deprivation. It was more than just a coincidence that all of these things started happening. Sudden onset of anxiety, depression, brain fog. Her photographic memory was gone. She developed arthralgias, myalgias, and other inflammatory conditions. She suffered metabolic changes. Autoimmune diseases suddenly hit. She developed asthma. Her normal allergies, everybody has airborne allergies, went to severe. And she developed Hashimoto's autoimmune thyroiditis, which actually I had to diagnose because my doctor buddies, and they're my best friends, didn't think to look for it. And they're good doctors. So most of my friends are traditional medical doctors, and so they ordered Premarin. Well, it made her worse. And then they ordered estradiol tablets. Well, it didn't help. And so in a desperate attempt to save my girl, I had an idea, I don't know where it came from, and I developed estradiol transdermal gel, and finally I started seeing improvement. And that was in the days when this was 1986, and there was not a lot of medical literature out there at the time, and that we could find, and certainly Al Gore hadn't invented the internet at that time, so how could we even find it if it was there? So luckily, now knowledge, science, and experience have evolved, and we've realized that the best chance for health and quality of life, that we must maintain a balance of the actions of all of our hormones, including estradiol, estriol, estrone, progesterone, testosterone, DHEA, pregnenolone, cortisol, and the various metabolites of all those hormones. As a matter of fact, that statement that I just said is actually paraphrased from the medical school textbook, Clinical Gynecologic Endocrinology and Infertility, written by Dr. Leon Sparoff, MD. Dr. Sparoff, by the way, also said that it can only be called a hormone if it's naturally occurring in the body. And he went on to say that if you take the structure of a hormone and you alter it, it's no longer a hormone. It becomes a drug with different effects and different side effects. So to answer the question, how do we know the actions of bioidentical hormones differ from FDA-approved drugs such as medroxyprogesterone acetate, levonorgestrel, and ethinyl estradiol, other than the positive outcomes that we observe every single day in the practice and the significant body of evidence that we've discussed? We can just ask Dr. Sparoff. Now, I have a lot of prepared information. I'm happy to go longer if you wanted me to talk about pharmacokinetics, how we can, as a compounding pharmacy, influence that, or I can allow you to go on to Dr. Allen. By the way, Dr. Allen was helped me when I developed estradiol transdermal gel in 1986. He was at the University of Oklahoma Pharmacy School, and I said, Doc, my professors at UT Southwestern, at Southwestern Pharmacy School, said that you might be able to help me. I wanted to test the potency and also the stability of this new thing I developed. I mean, back then we didn't have a lot of labs that could do that. He tested it for me and said, Jim, this stuff is stable for 6 months. He said, your potency is right on spot. He said, good job. So